Veris Health is a digital cancer care company that provides devices, a patient-facing application, and an online platform for oncology care. These devices are Bluetooth connected and allow for seamless and easy transmission of patient physiologic data. The app allows patients to report their symptoms as well as viewing their data and submitting other data elements that are helpful for their care. And the platform allows clinicians to not only view that data, but to communicate with the patient and support some of the telehealth capabilities. The Veris platform also assists with their documentation and with their billing and coding requirements. And of course, all of this ties seamlessly into integration with their EMR bidirectionally from the Veris system. Yeah, so what brings Veris Health to HIMSS is, Veris is a digital cancer care company, and we did a really thorough meta-analysis on the literature surrounding remote patient monitoring for oncology. We looked at the past 23 years of research that's available, clinically published research across 10 different countries and 4 continents. And we analyzed all of those for specific outcomes of the clinical side of how they've impacted care for patients, the patient experience, what they've led to for in terms of how the patient reacts and goes through the process, what the cost reimbursement and cost reduction models, what do those look like, as well as the technology that's used to support these RPM programs. We also understood or discovered what the future of RPM may look like. And here at HIMSS, we had the opportunity to present that information to the healthcare community.
RPM for oncology is important now because 1 in 3 Americans will be diagnosed with cancer in their life. That means 1.8 million new cancer diagnoses per year, and 80% of this treatment in oncology is done as outpatient. And in order to improve the quality of care, we need new solutions, and RPM brings us there. The current cancer patient journey starts with the diagnosis and then goes through different rounds of treatments. But the problem is that between the diagnosis and the treatment, the patient will always be at home all by themselves. And then they go into the infusion center to get their chemotherapy treatment. And at that point, they see the physician. But in the gaps, nobody's there for the patient. So when we look at the beginning, like between the diagnosis and the first treatment cycle, we don't have any baseline to see how the patient is doing in order to compare it later. And then between the different chemotherapy cycles, if something happens at home, the patient can call the nurse hotline and ask for help. But it's very difficult for a physician at the end of, in the evening to determine if the patient's diarrhea is really can be managed at home or they should go to the emergency room. And with RPM, we get additional data to make a better decision. So the hypothesis for RPM for oncology is that through a better tracking at home, we are able to detect symptoms earlier. And then once we detect the symptoms earlier, we're able to treat them earlier. And as a result, we have an improved clinical outcome. And the improved clinical outcome will result in better patient satisfaction and in addition, reduce cost. So the clinical outcomes for landmark studies in RPM, we would like to highlight 3 studies. The first one is a randomized controlled trial done by Bash et al. At Memorial Sloan Cancer Center in New York. And what he did in between 2007 and 2011, he looked at 750 patients with advanced cancer. And what he did, he sent them an email survey where throughout the treatment of the chemotherapy cycle, he would send them continuously emails and asked about their symptoms. And then the patients would report back, and based on their answers, they would either get a call directly from the nurse or be asked to come to the clinic the next day. So this methodology seems simple now in 2023, but if you look back, the FaceTime on the iPhone was invented in 2012. So it was the pre-FaceTime era. And with this technique, he was able to increase health-related quality of life by 16%, decrease ER visit by 6%, and also increase chemotherapy adherence by 1.9 months and increase survival by 5 months. Another really important study is by Colisée. This was 10 years later, where technology advanced. There's no more email surveys. Everything is on the smartphone with an app, and the patients reported their symptoms. And what he added in addition to it, he looked at the data from the Health Information Exchange in Arkansas and was able to see how RPM for oncology affected ER and hospitalization admissions. And he was able to decrease ER visits by 26% and then hospital admissions by 13%. And lastly, I want to highlight one more study that was done by Dennis et al. In France. And he looked at stage 4 lung cancer patients. So stage 4 in oncology means that the cancer spread from the initial side to the other side, and now it's not curable anymore. So these patients also got a smartphone app and reported their symptoms. And due to this technology, he was able to increase survival by 9 months. And just to highlight these results, so if the chemotherapy agent would be able to increase survival by 5 to 9 months, it would be a blockbuster medication overnight. So it's really remarkable to see what we can do by just improving the care and how this reflects on better outcomes for the patient. So patient satisfaction and compliance with RPM is, let's start with satisfaction. The satisfaction is really high. And in order to understand why, imagine there's times where the patient sees themselves more as a customer of the healthcare system. For example, when we are getting our flu shot, we want easy accessibility, we don't want to wait. And there's other times when we're really sick, where we see ourselves more as the patient. And in doing these times, we really appreciate an additional support. And RPM brings this support to help the patient feel safer at home, because they can always report their symptoms. They know that the physician can see the vitals and has a really clear view over their health at any given time. And this also translates into a really high compliance. It is above 80% of compliance. And there you see really, again, this interplay, how the patient really appreciates the additional support that they get. And in return, they work really well with the program.
Yeah, so the impact on costs from remote patient monitoring is really interesting. We looked through the literature for the past 23 years to try to understand what hospital systems have seen. And in large part, what was identified is that there are 4 main areas where hospital systems saw a reduction in costs using an RPM program. So these were fewer inpatient admissions, decreased clinical workload, value-based contract incentives, as well as decreased readmission rates. And what's really interesting to call out is that a lot of these are indirect cost savings. There were, in fact, actually 2 studies that looked at direct cost savings for patients in these programs and identified a specific dollar amount. One of them was a study in France in 2018 that found that patients with their follow-up appointments saved on average 362 euros per patient by the Healthcare Institute. And then a similar study in 2020 found that a health system can save up to $5,000 per patient for the duration of their treatment, and primarily through keeping patients out of the ICU where the costs can be high. Interestingly, there is a reimbursement model available for RPM, and what we found in our own investigation and from talking to folks in the community is that it doesn't appear to be widely known that RPM programs are reimbursable. CMS, in fact, actually provides 4 codes specifically for remote patient monitoring programs, and these range from initial setup and onboarding of the patient to the program, to recording of their physiologic data and transmission of that, and then to the clinician monitoring time. So to provide a little more detail, if a patient is recording vitals for 16 out of 30 days in a calendar month and sending that data over to the health system, there's a CPT code that can be billed for that on a monthly basis and provide reimbursement to the hospital system. Similarly, for every 20 minutes that a physician spends monitoring those patients, for a total of up to 60 minutes in a calendar month, there's additional CPT reimbursable codes for that. So if we really put it all together, a practice that's fully utilizing all of these codes is looking at roughly $180 per patient per month in terms of reimbursement.
The RPM technology helps us create an actionable diagnosis by bringing three key components together. So first one is the subjective data, second is the objective data, and the third part is the intervention. Now let's talk about subjective data. So this is the information that the patient transfers to the care team. For example, the symptoms about like the diarrhea or hair loss that they experience throughout the chemotherapy. But we have to think even beyond that. For example, mental health data about depression or even social data belongs to the subjective data. Now then, let's talk about the objective data. So those are the vital signs that the devices record about from the patient. So we have the heart rate or like the temperature to detect the fever. But there's other really important signs in oncology. For example, the weight, where like a weight loss is a worse prognostic factor in oncology, but also steps, because steps have been shown in studies that the more steps a cancer patient does, the longer the survival is. And then lastly, the intervention. So there's the classic intervention that we know where the care team reaches out to the patient through like a video call, but RPM does more. We have the messaging, which is like asynchronous, so it helps the patients better and they can incorporate it easier into their lives. And very interesting is also the educational component that RPM brings. Because the problem is that when a person gets diagnosed with cancer, and during that time they receive all the information, but then as they go through the treatment process over the next 10 months, there is no refreshing of this information, and the patient actually retains very little of it. With RPM and the continuous symptom reporting, every time they report a symptom, we have that opportunity to teach them about the symptoms and the treatment to really like elevate the knowledge so that they can become active participants and like really engaged in their own treatment and care.
Veris Health offers a lot in the remote patient monitoring and cancer care space. So being a digital health company, Veris Health, the Veris platform provides a series of devices that are right now Bluetooth connected and can easily capture the patient's vitals and transmit it automatically to the care team so that they can see this information. The Veris platform also provides excellent customer support and integration with a hospital system's EMR, so that this data is flowing seamlessly back and forth between their existing workflows. What's important to call out, the Veris system also contains support for Spanish, so there's multilingual support there for a large subset of patients. The Veris platform also provides billing and coding support, so direct integration to make sure that those billing codes that are really important in the data that's captured on the billing side is transmitted easily and seamlessly over to the billing systems that the health systems use. So the future of RPM is really interesting in that it's heading first towards the data that's collected from RPM-enabled devices. So there's a lot of connected devices available right now for patients that are on an RPM program. And this data can be paired with the patient-reported data elements like symptoms or quality of life scores. And all of this feeds into a data lake. And that's where the real power in the future of RPM can come from, of the intelligent machine learning algorithms that can be developed off of these large data lakes that exist. The RPM technology is also integrating with other areas of other technologies within the healthcare ecospace. Things like patient education materials that are specific and tailored to that patient given their treatment and given their existing condition. Pairing this with genomics data, as well as pairing it with patient quality indices that give you an idea of how the patient's disease is progressing. And finally, pairing this with digital assistants, chatbots that can help with answering questions related to a patient's condition. And perhaps one of the more exciting areas that RPM technology is heading in the future is with implantable devices. And this is actually something that Veris Health is working on, a device that can constantly be measuring the patient's vitals and in real time transmit that information over to the care team so that they can make an early and immediate intervention as needed for the care of that patient. as well as reducing that burden on the patient to have to manually take these readings and transmit that data over every time that they do that.